So it really gives you a better understanding of the tissue with various imaging techniques. So you can really then look into different mechanisms of the tissue and interactions, and also metabolic features of the tissue that is otherwise not possible. And we try to do that in a label-free way. So it's really, the tissue is in it's a natural state, so to speak.
Hello everyone, and welcome back to the Neuroscience and Beyond podcast. I'm your host Willem, and together with my amazing team of graduate students, we're on a mission to bring the wonders of science, especially neuroscience, closer to you. Have you ever wondered how an idea born in a university lab can transform into a life-changing invention? Meet Dr. Lukas Krainer, a physicist who completed his PhD at the prestigious ETH University in Zürich and turned his research into a thriving entrepreneurial journey. He's the visionary behind Prospective Instruments, a company revolutionizing imaging with flexible and portable two-photon microscopes, an essential tool in neuroscience and clinical diagnostics. In today's episode, we will explore how this innovative technology is making advanced microscopy more accessible. We will discuss the challenges of entrepreneurship and Dr. Krainer's advice for anyone dreaming of starting their own company. Before we begin, I'd like to mention that this podcast is a separate activity from my position at the University Medical Center Göttingen in Germany. We are supported by the International Max Planck Research School for Neurosciences, the Cluster of Excellence Multiscale Bioimaging, the European Neuroscience Institute, and SFB 1286 in Göttingen. If you'd like to support us, please subscribe to our channel and do not hesitate to leave a comment below. And now, dear listeners, please enjoy the conversation with Dr. Lukas Krainer. Dr. Krainer, thank you for coming to our podcast.
Thank you for being here and inviting me to Göttingen.
So I would like to start by telling how we established our contact. We don't know each other, and I'm very happy to announce that people actually watch our content. And a friend of yours, he watched one of our videos. It was about two-photon microscopy. And he reached out by knowing already the limitation of this technology by saying, hey, I have a friend who has started a company and who is producing actually very nice devices that maybe will solve some of the problems and limitations of this, the current, let's say, two-photon microscopes. I'm very curious to hear more about this technology, but let's start by first defining or explaining what is a two-photon microscopy.
So the two-photon microscope is probably 35 years in the making. It was invented by Denk, Stricker and Webb in the late 80s, roughly. So it's, in that perspective, not super new, fancy, hot, quantum optics stuff. However, the two-photon microscope enabled at that time to really look on the cellular level into tissue, not just on a scratching on the surface. So you can really go down into the tissue, 0.5 millimeter, 1 millimeter roughly, on a cellular level, cellular resolution. So it really enabled to watch processes on that resolution level in 3D. So, which was a major advancement actually at that time. So the two-photon microscope uses a laser. And it's not just an ordinary laser like a torch, it's a femtosecond laser, and that's where things get complicated already. So the femtosecond laser is needed to create this tiny spot in 3D, the optical sectioning, and which allows then the 3D image. And this is one of the problems why two-photon or multi-photon microscopes, as we refer to it nowadays, still in the making, actually, since 30 years after the invention. And however, it's an indispensable tool. Probably you guys also work with a lot of two-photon microscopes, so you also know the limitations, probably. It's an indispensable tool in neuroscience, but also nowadays in organoid, spheroid, tumoroid research, in not just morphological structures, but also metabolism. In label-free imaging, so you can do a lot of things with it, actually. And so it's a very powerful technique. But yeah, it has its technical limitations still, and we try to solve that fundamentally, and once and for all, actually, to bring it to a wider user base, this technology.
You mentioned that it is very important for neuroscience. Do you know why is that?
Yeah, so the two-photon microscopes allows a 3D image of various tissues, and of course the brain tissue. I mean, the brain tissue, probably you know it better than me actually. It's a highly dense, packed tissue of cells and neurons, and all the connections between the neurons. And the two-photon microscope allows you to watch single neurons and a pack of neurons, how they interact with each other, how new connections are formed, how they are reinforced. So learning and how our brain works, but also in Alzheimer's research, dementia, glioblastoma research. So of course all the problems that come with the brain, can be investigated by the two-photon microscope. So it's an indispensable tool in neuroscience, but also nowadays it stretches into pathology. There are now other startups working on pathology applications to reduce the time of having really from the resection to the diagnosis, to reduce the time from, let's say, 5 days to 5 minutes, which is also one of our aims, actually. So in pathology or in organoid research, and in addition to that, you can use it in living animals, right? So it's not dead tissue, but in living mice or zebrafish, rats and birds, actually, and all sorts of living animals. So really to understand the brain, which is still sometimes a mystery, as we all know.
Yes, it is actually a big mystery, yeah. And as you already, you said it and you explained it, and you probably know that, you know for sure that one of the biggest advantages is that you can go, as you said, 3D, meaning in depth, like maybe, 500-600 microns in the tissue.
Yes, about a millimeter,
like
maybe 1.5 millimeter.
Yeah, which is very, very practical when you want to do live imaging experiments. And as you already mentioned, a lot of this live imaging in mice, for example, is done with these Krainer windows and two-photon on top. Right, and then the animals are still alive, so it is not incredibly harmful, let's put it that way, to the animal. And that's interesting. That I did not know that two-photon is used that heavily in diagnostics also. It's
not yet used, but there are a few startups company now really working on the use of two-photon or three-photon or multi-photon instruments in pathology. So you got a few label-free, as we call it, label-free effects in two-photon microscopy. So that means you don't need to really put the tissue into a solvent or dye to make cells visible, for example, via marker molecule, or neurons with a GFB marker molecule. So you don't need to do that. So you can just use it as an intact regular tissue, but still make structures or the morphological structures or metabolism visible with the two-photon microscope via label-free effects, as we call it. So collagen, for example, converts the incoming laser light into the green, into a visible laser light. So you can collect a visible laser light, which indicates then the presence of collagen or the structures of collagens and all that stuff. You can have a third harmonic effect, we call it DHG effect, which comes into play when you have refractive index changes, so like boundaries of cells or tissue boundaries. So that can also lead to a better understanding of the tissue without actually preparing the tissue. So the tissue as it is, right, in its natural environment. And if you're thinking further down the line, we also say like a coherent Raman imaging, which is a very powerful technique for label-free imaging, to really identify single cells and molecules through the Raman effect, the vibrational structure of these molecules. That is in some sort also multi-photon instruments, because you have multiple photons interacting with each other at the tissue location. So and that also comes into play, so you can really diagnose or investigate tissues on various levels, which then gives you a complete picture. So we try in our device, we try to bring in orthogonal imaging modalities, so techniques, into a single device together. So it really gives you a better understanding of the tissue with various imaging techniques. So you can really then look into different mechanisms of the tissue and interactions, and also metabolic features of the tissue that is otherwise not possible. And we try to do that in a label-free way. So it's really the tissue is in its a natural state. so to speak.
That is very interesting. I was not aware of this modality. I mean, we've always seen this GFP expressing, or like fluorescence protein expressing animals, and then you have the 2-photon, and you can study whatever you want to study. But I was not aware of this kind of label-free modality, which is very interesting, because I am studying the extracellular matrix, So maybe I can apply this to my studies, but to this we can maybe talk off of the podcast. But it's really, really fascinating, and this allows you then to be kind of more precise if you want to study endogenous molecules, right, or dynamics, because if you want to tag a molecule, let's say with a fluorescence protein, most of the paradigms that are used are so-called overexpression, where you have a certain protein in higher amount than usual. Of course, nowadays you have CRISPR, when you can actually modify the gene and endogenously express the same amount with the tag protein.
Right.
But the most common techniques are this overexpression. So really this label-free investigation is a very, very interesting aspect that I was not aware, and thank you for sharing this. Yeah.
Right, exactly. Yeah. So now that's a really powerful technique, and these label-free techniques, they also have been around for a while, but it always comes down to the same problem, that you have a very complicated device at the end. So you need this femtosecond laser, which is so far, super huge. It's like probably 1.5 meters by 1 meter. Water-cooled power supplies underneath the table, lots of cables and all of that stuff. And it has to warm up in the morning, probably you know that. So you come in the morning, you switch it on, you go for coffee, or you pretend to work it somehow as a student. And then you come back, at like 11 or so, and everything is warmed up, and then you can start your imaging experiment, if it's still aligned, everything. So it's like, even the technique is very powerful, it's still prohibitive. The implementation actually of the technology. So we said, okay, let's try to reduce it to the max, these lasers, and make a shoebox size turnkey system, air-cooled, really small, cost-effective, and integrate it into the microscope in a way that the technology is not visible really to the user. So it's like a box, like so to speak, like a black box, where the laser and all the core technologies are built in, actually, and the user only gets a display, mouse, keyboard, and you plug it in, and after 5 minutes, you're ready to go. And you can actually do it besides your office. It's a very small device. You can put it on an office desk, and of course, you need to make it dark sometimes, closing the blinds. But you don't need to go. You don't need to go to level -2. Usually, I mean, all the core facilities are in like -2. No, in most cases.
Upstairs.
As a student, I mean, as a PhD student, most of the time, you spend in -2 in darkness. Summer or winter, it's often noisy. I mean, they have the chillers and the water cooling running, and all the instruments and the PCs and the air conditioning and all that stuff. So it's noisy, it's dark. You spend like 4 hours, 8 hours, 10 hours sometimes at the microscope. So when the experiments are set up, you go for it. You take your data. And that's usually -2. And if you have let's say you have a very small compact device, you can put it into 8, maybe floor 8. So you go from -2, you go to 8, which is a 10x improvement in floor level, maybe, And also when it comes to probably like, things we didn't think about at the beginning, but when it comes to mental health, issues for PhD students, so you don't want to spend like months or years in -2. Right, so maybe you want to go to 8 and do your experiment there, and once you're done, open the blinds, and you can do all the data analysis and all that in a nice environment, where you can enjoy the view and still work on your data, and you don't need to do it in -2. So that's also an aspect that we didn't think of the beginning, but I see sometimes conversations and in news groups and on the internet that sometimes that can be an issue, that if you do it over a long time, it could become an issue. So that probably can also be solved having a really super compact, easy to use device, but still with a high performance, So we don't really compromise on performance, It's because everything is tightly integrated, built together in a way that we don't compromise on performance, but make it really easy to use. We hide the technology from the user, so everybody can use it. You're not afraid of breaking something, so you can really work with it and use all the functionalities that you have, and but still give the user the flexibility to add things later, for example. So other imaging modalities, or to be able to work remotely. So all the functions are software controlled and motorized, like the objective revolver or the modality switches. So you can sit side by side and operate the instrument, and you don't need to go to the instrument and change something and come back again and stuff. So all these things really to make it easy and simple to use for the user, but still being able to do his job actually in a kind of nice environment.
That sounds very cool. So if you allow me to summarize, and I want to put things in perspective to people who have no experience with two-photon. So I don't have experience per se. I've seen people working. We have one in our lab, and today we have Laura behind the camera, and she's actually working with two-photon. She knows exactly what you're saying, the dark room, the noise, the alignment, etc. So for people who don't know this microscope, first of all, it's a huge machine, and you need a room that is maybe 4 by 4 square meters or even bigger. The room has to be dark. You have to have this kind of cooling system, as you said. And probably one of the biggest struggle is this alignment of the lasers that need to be really aligned so that things work precisely. And very often they get misaligned. You have troubles. You have to call the support. They take their time, and all of this kind of slow down your experiments, and you're frustrated. And as you said, very often these things are somewhere ground floor underneath, like -2 or whatever. And it's indeed, you just spend the whole day in a dark room. And we are here in Germany. In January, it's basically you go to work and it's dark. You spend the day in the dark room, and then you come home and it's still dark. And you're like, right. really, you have to take excessive amounts of vitamin D so that you don't get depressed, And
That's true. That's true.
Another limitation is that these machines are extremely expensive. We're talking about from $500,000, and they can go up to 1-2 million even. I was recently in the States in Cold Spring Harbor lab. Right. They have this very interesting, very nice, I recommend it all the time, course about microscopy. And one of the companies, the vendors that were there, they show us their product, and it was indeed a room. And he said, I think that this is like up to roughly $2 million because of the lasers, because of this and that, and it's incredibly expensive. And when you say like we have a device that you can put everywhere, I see also another plus. We talked with one of our previous guests, Professor Jan Husken, who is developing light sheet microscopes.
Right, saw that, yeah.
Exactly, in a very similar way. They're called flamingos, and one of the plus that is amazing, in my opinion, is that you can actually send the microscope to somebody else. If you want, instead of sending the samples, if you have living samples, send the microscopes, they can image, bring it back.
That's true. Yeah.
You can also share it in a facility. You don't have to go to the room, but it's really, really interesting. And I'm curious to hear more about it, but before we go there, can we maybe disentangle the name two-photon, because it's like two-photon. What exactly are these two photons doing?
Right, so we know from quantum mechanics that when you have a molecule, electron, you excite the electron to upper state, and when it relaxes back to the ground state, it emits a photon, which we call fluorescence. And you can do this with two photons. So if two photons meet at the same time at the electron, at the molecule, with half the energy of the required gap, then they excite the molecule, and then it relaxes back to the ground state and emits a photon. We call it fluorescence. We detect it, and that's it. So these are the two photons that really have to meet at the same time, at the same spot, at the molecule that you want to excite. You can also do it with 3 photons, so you don't have 2-photon microscopes. There are 3-photon microscopes, even 4-photon microscopes. So there's a little bit of variety in this one. And how do you do that, right? So this is the problem: how to excite a molecule with 2 photons at the same time, at the very same time. So you take a femtosecond laser, which nowadays femtosecond lasers are an ubiquitous tool in modern production and micromachining and also quantum optics and all that stuff. So you take a femtosecond laser, which is basically emits flashes of light, very short. And they are very short, right? They are probably they are as short as a hair is thin. When you could imagine they, zip across your face, and you could see it actually. You would be able to see it. It's very thin. These flashes of light. So these flashes of light, they come to the tissue, and they are focused with the objective to a tiny spot. So you can imagine this very thin sheet of light, flash of light, travels through the objective, and it's focused into the tissue. So at the focus spot, what remains is a really small dot point of high intensity light, and otherwise it's dark. On top of that and below that it's dark. So this tiny spot then interacts with the tissue, and those two photons or multiple photons interact with the tissue, and then the molecule is excited and falls back to the ground state, and emits a fluorescence photon, and then you can detect it. So that's the principle of the two-photon microscopes. And so we know that photons of half the energy, they have a longer wavelength, which means, because as we said before, brain is highly dense and packed together, so light is scattered when it travels through the brain, and you have longer wavelengths. So they penetrate deeper into the brain, and when you go from a two-photon to a three-photon microscope, where you even use longer wavelengths, they're even less scattered, so they can penetrate deeper into the tissue. So two-photon microscope typically goes to maybe 500, 600, 700 microns, and a three-photon goes to 1 millimeter, sometimes 1.5 millimeters. So it really depends also on the sample, but that's how you can penetrate into the tissue. Compared to a conventional confocal microscope, where probably some users know about it, it gives maybe a factor of between 5 or 10 in penetration depth compared to a confocal microscope. And there's another advantage: you can do better time-lapse imaging. So because it's more gentle, a two-photon microscope, because it only interacts in this very tiny spot with the tissue, it's much more gentle on the tissue. So photo bleaching or phototoxicity is less an issue. That means you can of course work with a sample over a much longer time scale. So doing time-lapse imaging, or just see how the cells grow or split or behave over time, which is better to do with a two-photon microscope than with a conventional microscope. And as I mentioned before, the label-free imaging comes into play. So SHG, THG, but also coherent Raman imaging, these technologies, they can be implemented with a two-photon instrument, giving you additional access to optical techniques that you don't have with the conventional confocal microscope. But still, the confocal microscope is still around, and I think there's still a big market for it, because it's not that complicated. People are used, you have a CW laser, people are used how to use it. It's cheaper usually than a two-photon microscope. So the confocal microscopes, they are definitely still there, and they have their place in the market. But eventually, our opinion is that a two-photon microscope is fundamentally much more powerful than a conventional confocal microscope.
Yeah, as I said, there are different kind of purpose of usage, right? Also with confocal, you use it a lot in fixed tissues that you don't care that much of the, you're not gonna damage the living animal or something.
Right.
And you use it for some other things that, for example, we now use it in expansion, where we have basically proteins that we can make visible even with light now. To study the structure, which is very cool. But once again, I would like to reiterate and summarize, maybe you correct me, for people who don't have that much experience, and now we can go to high school physics. So let's take, for example, a green fluorescence protein that has to be excited with a wavelength, let's say roughly 480, 90 nanometers, meaning in order to excite it with the two-photon, you have to send a wave, let's say in this far red range that is roughly 800 nanometers, and then two photons, they need to really meet exactly at the point where you have the protein so that you excite it. And very cool thing that you've already described is that you excite only this teeny tiny spot, nothing above, nothing below. With confocal, you also have a focal plane, so to say, where you focus your laser at a certain point and you collect light from this point, but you also excite above and below your focal plane. You don't collect this light, therefore you have this nice resolution, not with a wide field where you excite everything, you collect everything, you don't have that resolution. And two photon allows you really, because of this kind of physical properties of light and scattering and everything, to really go in depth into the tissue and collect only from a certain point, which is very, very good for live imaging and time-lapse, as you said. So now I'd like to continue asking you about your invention. Let's get the box and then take it into parts. What kind of detectors do you have there? When you say femtosecond laser, what does it mean? Do you have like a laser that is constantly having shining light, or is it like some pulse that is with femtosecond pulse?
Yes, so the femtosecond laser emits a continuous stream of pulses. So these are light flashes, right? So if you go out at night, to a disco, so you also have this stroboscope effect. So basically, that's a femtosecond laser. However, the duration of the light pulse is super short. So it's 100, let's say 100 femtosecond. To put it into perspective, it's if you would have like a 1 picosecond long pulse, it's 0.3 millimeter, so 100 femtosecond is really as thin as a hair, basically. So it's a very thin sheet of light that travels through space, and in between is darkness. It's complete darkness. Then there's a small, very thin sheet of light, and then there's darkness again. And this comes with a certain repetition rate of light pulses. And these lasers, they have been developed in the last 20, 30 years as well. From a academic PhD type of do-it-yourself project into industrial products, and there are now many companies around the world being active in building and producing femtosecond lasers, and also my previous company was involved in femtosecond lasers. So now the difficulty comes into play when you work with tissue. That, as you said, GFP. You have to excite it maybe in 940 or so, in that range somehow. But if you want to work with RFPs, red fluorescence proteins, you want to excite it at 1030, maybe more on the longer side, But also endogenous proteins like FAD, NADH that we have in our body, you want to work maybe at 760 or 770 nanometers in that range. So what you need actually is a femtosecond laser that can change color, can change the wavelength. Not very fast, but you need to be able to set it and then work with this wavelength. So the difficulty is to really produce a very small but still high power wavelength tunable femtosecond laser, which is small enough to fit into a tiny shoebox size space, but still powerful enough to really go through the optical system. So in the optical system, you have scanners. Obviously, one to scan the beam over the tissue. You have mirrors and lenses and tons of other optical elements to really fit in the beam into the objective and to collect actually also then the fluorescence from there. So really developing this laser is one hand, and it has to work 24/7. It has to be reliable. It has to start at the push of a button, and there's a lot of software and firmware integrated. A lot of safety aspects. I mean, you don't want to shoot a laser into the eye. So we always say, don't look into the laser beam with the remaining eye. So don't do this. So and from a cost perspective, I mean, as you have mentioned before, these instruments they have a certain price tag, like $500,000, 1 million plus minus, and probably. Femtosecond laser makes, in some cases, it's probably only like 30% of the cost, but sometimes it can be more than 2/3 of the overall system cost. So also from a cost perspective, from business perspective, controlling the technology of the laser is vital to really be able to integrate it. Then the next thing is the system integration. So you have the femtosecond laser, and as you said, you have detectors and a lot of filters and optics and scanners, and there's a lot of electronics involved and firmware and software, and all that has to come together in a super small and easy to use package. Where you don't need a connect like a water cooling to that system, and then you want to have a software which controls everything. At push of a button, everything boots up, starts up, gets warmed up, and aligned, and all of that stuff. So modality changes that need to go to the system and move some mirrors or changing filters in the darkness, and where is it, and cleaning the marks of the thumbs and fingers, from the other users, didn't know how to touch a filter. So all of that has to be motorized and software controlled, and the objective revolver, and like a workspace illumination that you can work in the darkness when you have to look where your sample is, or maybe change something on your setup. So all of that has to come together in a single housing and a single package. And in addition, because we integrated, we shrink the laser in size and integrate it into our system, it allows us to actually do, as you mentioned before, the laser transport from the laser source to the sample. Actually, it's fiber-based. So the light comes in a small little, like a few micron thick fiber, optical fiber, which then allows to design the scan head or the system which actually scans the probe in a way that you have a flexible connection to a controller. So you can take it off, actually do it upside down, and you don't want to always image upright. From when the laser light comes from the top. For example, if you have like live animals, like a mouse, of course, as you said before, the cranial window. I mean, you don't want to fix the mouse, on the back on the table and then image from below. So you want to have the mouse in a natural environment and come from the top, right? So as we call it, upright. But if you have like organoids, small little mini organs and or maybe well plates, or cell cultures, petri dishes. It's a good example. You want to image from below, right? So the light comes from below and goes up. So actually you want to get the whole microscope of the fixation or the stages you have, and you want to turn it upside down and transform it from an upright to an inverted, with maybe the help of your colleagues, maybe in 10 minutes or 15 minutes. And so you're not really bound to, okay, this is only for mice, and the other 1 million we spend is only for organoids, so let's spend a little bit less and be able to use it. And also for maybe plant growth, where you want to image 90 degrees, from the side. You want to pull it maybe at these oblique angles and have different angles of imaging direction. So that freedom to really integrate everything and put all together, and you don't have free space beam alignment anymore, gives you also the advantage of being able just to freely image the samples from oblique directions that you didn't think of when you purchased the instrument once in your life. Probably it might be like this. No?
That's very cool, actually. Really, really flexible. What kind of detector do you have? PMTs or
yes. So obviously there are not too many companies left in the world. Doing this. There's now a new technique coming up, which is the silicon photomultipliers. We're going to release an SCPM soon. That is, it has a little bit higher noise than a PMT, so it's a photomultiplier tube to PMT, which is a very sensitive detector, basically. So you have a few photons coming, and this detector really amplifies the photons and gives an electrical pulse, and this electrical pulse you can measure and then correlate it with the point where you are on the sample. So the SCPMs, it's a very interesting technology. They're super cheap. It's a die, basically, CMOS compatible. A few €100, and you can package it in a electronic package, in a very compact package. You have to cool them a little bit, so usually you need to cool them to minus 10, minus 20 degrees. But super small, you can do that as well in a cost-effective manner and way, and then you can integrate it into microscope. So we are not really bound to PMTs. We can also work with SCPMs. And also for coherent Raman imaging, for one technique, SRS, you can also use a silicon photodiode actually. So you don't necessarily need a PMT.
What is the advantage of this new?
It's a label-free technique, so you can really aim on the vibrational resonances of molecules, the fingerprint region. So it gives a lot of advantage, especially nowadays in pathology. There are a few startup companies working on pathology applications where you can use this effect on getting an H&E, like a hematoxylin eosine image, right from a fresh tissue. So you don't need to stain it anymore. So there are a few also European startup companies, US companies that focus on getting, to reduce the time from having a resection, tissue preparation, and actually that you get the diagnosis like 5 days, which are horrible for some people waiting for the diagnosis, getting from 5 days to 5 minutes. So that's also one of our aims, that we want to reduce this time where you really can have to diagnose sometimes right on spot, so during an hour, or if you have like a breast biopsy, and the patient does not need to come out of the NMR, go back to the station again, and after days, it's diagnosed. But you can take a biopsy right at the spot of the NMR, diagnose it, and maybe tell the technician, hey, you missed it, do it again, or whatever like this. So really getting the time from 5 days to maybe 5 minutes. That's one of the.
So basically,
aims.
you need to just put the instrument in a room next to this room, and then do your imaging, and that's amazing. H&E, the things that you mentioned, is a conventional staining technique that is very, very old, and basically
over 100 years now. I think it was the H was maybe 1870, and then the E was 1890 or so invented, and it's the way that of course the physicians, they are trained for that now. So I got this big pathology book that probably a lot of doctors know, and it's all it's in there, right? So you cannot come up with a. We also thought, okay, we're gonna have a new technique of two-photon images, and then you just need to train the pathologists to look at that. But they say, no way, I mean, we have these big books, it's 100 years old, more or less, and then they but I understand. I mean, from a personal view, they also don't want to take the risk, of making a diagnosis, maybe life and death, and then you say, well, it's just something new that we didn't train on it, really. So I can very well understand that there's really the guys are really conservative, and that they just want to do it right now, even when it takes a little bit longer.
Yeah, but technological advancement always precedes our changing in our mindset with many years. Probably, I hope not, but it will take some time until. Even in these conservative societies like Germany, for example, it takes a lot of time to implement new technology or digitize something or whatever. Right. So people are just used to this, and the system is working. And as you know, there is this saying, never change the working system.
Yes, that's true.
It's really something that is remarkable. And as you said, it's not only about fundamental science, but also bringing to the patient and maybe contribute to saving many lives or improve the life quality of people, just because you introduce a new method that saves, let's say, 5 days, 10 days or whatever, which is incredible. I really, really love this idea, and I'll probably follow your invention in the future. Speaking of your invention, how did you come up with this idea about such a box that can basically address many of the problems of two-photon microscopy, and then offer a solution to them?
So it's this third startup company that I'm involved with, and the other startup companies prior to that. So my second one, which was 1.5. We have been a laser producer, femtosecond laser producer, and serving different markets. I mean, the biggest market at that point was the femtosecond laser-assisted cataract surgery, which just came into fashion actually after the LASIK, which is a much older procedure actually. But nowadays also the cataract is done with a femtosecond assisted system, and So we delivered also femtosecond lasers into two-photon microscopes. For a long time, and you always had this do-it-yourself community, buying a femtosecond laser and then tinkering, this two-photon microscope to the femtosecond laser. And each time when you visit customers and you talk to them, you saw this huge pile of mechanics and components, and also the commercial systems. It was just tremendously huge and cumbersome to work with that. And at that time, I already thought, there must be a better way of doing this. Simply, this sucks. It cannot be brought in a broader way, disseminated to other people when you need to work with stuff like this. And so in 2017, we have been lucky enough to sell our company to a bigger other company. And after a transition period, I was able to start this Prospective, now my third startup company, aiming really on bringing these two-photon microscopes to a level where everybody can use it, basically. So this was it. Also at that time, there were some presentations about instant pathology or digital pathology, and I always thought, okay, listen, if you have these big instruments, that will never work. I mean, if it's as big as an NMR or CT, you're not going to have that. You don't have the space and the budget, and it's too complicated, and all these things that you don't want to have, actually. So that's how I got into the field. But I'm a physicist by training, and so I still have sometimes problem to follow the biological path. I mean, I'm not a molecular biologist or like a neuroscientist, so that sometimes is not. I mean, I'm trying to learn, but sometimes not always easy to follow all the detailed discussions of neuroscientists and all that stuff. But you do what you can do best, right? Yeah.
I mean, it's not easy for us that we're doing these things every day. We still cannot follow everything, and the amount of publications that comes out is incredible, and you cannot read anything else than your teeny tiny field, and maybe from time to time any other paper just to to inspire yourself or see some other cool stuff. But it's overwhelming, the amount of science out there, and it's I totally understand when you say we cannot keep up, but therefore is this kind of a network communication, people talk, right. So this is how it goes, right? There is something else that I wanted to ask you. You mentioned that you started first this company about lasers, and you're a physicist by training. So you did your PhD at one of the most prestigious institutions in the world, ETH in Zürich. And how did you did you know during your PhD that, hey, I want to start a company? Did you know before that, or was it like during your PhD you kind of found out about this stuff and then, maybe it's cool if I start a company? And during this process, was there any support from your institution or any other organization, or you just was on your own and that was it? You were on your own?
No, so definitely ETH is a fabulous institute, and I was very lucky that I had the opportunity to start my study there. So with 18, I mean, I was born and raised in Austria. So with 18, I moved to Zürich to study at ETH. And then during the PhD time, I never thought about having a startup company, actually. And during my PhD, I was working on lasers for telecommunication. So that was in 2000, roughly 2000, so 1999 to 2002 or so, in that range. And I was working on these lasers for telecommunication applications. And then actually there was, based on my work, there was a startup company founded, which was operational between 2001 and 2003, roughly. It was called Gigaterra. And so we focused on developing lasers for RC, so long-haul transmission. At that time, maybe it's before your time, but there was the telecom hype, the telecom bubble, as we call it. And in 2003, the bubble burst, and there was a mass extinction of startup companies. And so even our startup company, even though we got like 10 million US venture capital, It's amazing how fast you can spend 10 millions actually. So it just goes like, and it's gone, you know. and in 2003, actually, the money was gone and the investors, you know, pulled the plug, and the Gigaterra was history at that point. But I was in the mid-20s or something like this, and I saw, so we had professional management at that point, and this, you know, all the VPs and CEO and VP of everything, and I don't know what, you know, lots of very knowledgeable people. But at the end, I saw, okay, they all put on their pants the same way, right? As we say in Germany, you know, die kochen alle mit Wasser, you know. So and that somehow initiated the idea of, okay, but I can be the CEO, you know. I don't need to be the PI or the leading laser scientist, but I can also be the CEO. It's not that hard, you know. Let's face it. And so after this transition period, then when the company burst and we got the IP back to ETH, and there were some other things involved in 2005. Together with my friend Gabriel Spüler, we founded 115. And so we learned from Gigaterra experience, and we said, okay, this time we bootstrap. You know, no $10 million VC. It was not there anyway, but so because everybody was bankrupt at the time. You know? So we bootstrapped 115. We started in a garage, and you know, really like soldering iron and screwdrivers, and we got a lot of stuff on eBay, because that was we have been lucky at that time from the telecom bubble. There was a lot of optical equipment on eBay, so you can just buy a whole lab, you know, on eBay for basically nothing, right? So we got the stuff on eBay and got lasers on eBay and optics and all that stuff, and we started in a garage, just like some other guys as well, and bootstrapping the company, but developing stuff and going on exhibitions and talking about the products and all that. And then, so it goes. And after 10 years, or probably, what was it? About 10 years later, we have been probably one of the top 3 femtosecond laser producers in terms of volume. So we made like 600, 700, 800 femtosecond lasers a year. So it was really high volume production, and we have been serving different markets. Also, STAT microscopy. So we have been delivering lasers for Leica Microsystems for their STAT microscopes at that time, and serving the femtosecond assisted cataract surgery, micromachining, but also basic research, linear accelerators, so all sorts of market actually. And then 2017, there was a big company offering a good price for the company, so we sold it, and then after the pandemic, there was still this pandemic thing, then Prospective kind of started. Yeah.
How hard was it to start Prospective during the pandemic?
Yeah, it was. I was a little bit. I think I'm an optimist by nature, so I always thought, that's in 2 months it's over. You know, easy. You know, it's all gone in 2 months. You know, or maybe maximum 3 months. You know, but then it's over. No, we got the vaccination and done. You know. Took a little bit longer. So, that was not easy, because all the researchers, everybody was in home office. So selling a microscope when people are in home office is pretty tough, actually. And going on exhibitions, there was no exhibition. So no customers, no exhibition, no demos, no nothing. So, that's the way it is, right?
It was hard, but now slowly it gets again, people go to conferences.
Yes, that's very good sign.
I don't know, have you been to one of these recent ones, the FENS or?
Yes. So I just came back from SFN, which is 2 weeks ago in Chicago.
How was it, by the way?
Yes. Was interesting. I think they had a little bit less visitors than usually.
They said 22,000 or something?
Yeah, but with exhibitors, so it's about 17,000 scientists. But I like it. It's super conversations, very active, vibrant. You see a lot of new techniques. Also, Two-Photon, when I mentioned it's 30 years, 35 years in the making, but there's no end in sight, I would say. It's really fascinating, with new ideas and new scanning techniques, and faster and more precise, and new imaging techniques for voltage imaging now, the voltage indicators, which is super exciting to see how that field evolves over time. So I think the next, maybe, I don't know, 10, 20, 30 years, there's no stopping, I guess. It always continues. So it's, it's super nice.
You said that it took like 10 years for your first company to kind of grow big and become like, let's say, establish a name on the market. What do you think? Is there any time span that you say, okay, the first 5 years just you run on red, and minus, and then maybe sometimes afterwards you can start generating some sustainable income?
Yeah, I think 10 years is probably about the time frame where you really need to build a company a hardware company, don't want to speak about software companies where it could be much faster, but hardware companies, hardware is hard to do, as we say. So it takes 10 years, to really establish this process in the market and reputation and, getting systems in the field. And supply chains is still, you have to deal with supply chain issues a lot. Like some microprocessors are missing, and oh God, what shall we do? So there's a lot of, especially as a small company. You need to take what is available in the market. So it takes about 10 years, I guess. So you really need to be there on the long run to maintain that over the years, right? Right.
Did you experience any problems during the, there is still ongoing military, operations, wars around the globe. And I must share with the listeners that I had the idea for this podcast a certain time ago. Then basically I pitched it in front of our program committee and then say, oh, that's nice. We can provide you the funding, give us a list, etc. So I gave them the list. It was like around January, I don't remember, 21, 22, something like this. And the first equipment arrived in August. So
yes, that's sometimes a problem still, yeah, that lead times are very long, yeah. And especially as a startup company, when you have long lead times, then the sales process takes long, the lead times takes long, and then the installation then takes long, and until you get eventually paid. That can be maybe 1 year, 2 years. So you really need to have some financial means of getting through this valley of death somehow to sustain. But it's the way you have to deal with it. There's no way around it.
Exactly, it is what it is.
Let's face it, yeah.
Do you have already customers that work in the field of neuroscience or any other related to, let's say, life sciences? Yeah, so we have some initial customers now, mainly in the US and also in China, actually. Some in Europe, but it's more US and China, actually, which are, in my feeling, they're a little bit more active in that range. Also India, we see there's some interest in India coming up. So it's really about US, India, and China that we currently focus on more. How are the regulations in China, by the way? I know that to get something to Europe is a struggle, but what is it the other way around?
It's there is some administration involved, definitely. However, you can do it. It's not that hard actually, especially when you. I don't want to speak about medical device regulations. That's totally different game. But research instruments, I think the Chinese are very open to that. Eager to work with it, and very demanding, of course. It's very fast, very dynamic. So it's definitely interesting. But it's okay. You can do it. Sure.
Yeah, they invest a lot in super resolution, especially in AI and things like this.
Yes.
They are really, really pushing the field, and a lot of strong groups that produce biosensors or fluorescence proteins or whatsoever, calcium imaging, one of the last neuroscience society meeting in Germany or the previous one, I don't remember, they were like a group really having several Nature papers back to back. Nature is one of these prestigious journals, and to publish there is hard, etc. This is another topic, but yeah, they're very, very strong in this field of imaging, and it's cool to see that they also are open for novelty, not only.
Yes, sometimes more than the Europeans, in my opinion. So even when everything is super polished and not perfect, organized, or then they say, it's new, I like it, we can work with it, and stuff. So they are quite open in scientific innovation and technical advancement.
There is one thing that I forgot to ask you. So you have this very nice, let's say, a box that is a microscope actually, and it's portable and it's flexible, and it's hardware. Do you have also software that is easy to use, or what kind of software do you use with your microscope?
Yeah, so our software really takes care of the whole system. So you also see system parameters, laser parameters. It's all in a single software user interface that should give the user a feeling of, okay, the workflow kind of is the typical workflow, is outlined. So you can follow it, and even I can use it actually. I don't work with it every day, So it's I think it's relatively straightforward to use. But it's still a microscope. I mean, it's not it's not a toaster or a dishwasher, but it's still a microscope. But I would say compared to all the other microscopes, it's something that even undergraduate or graduate students by with some initial training can easily use. So actually, when we, as you mentioned before, when we ship the microscope, we don't install it actually. So we ship it, you get it in a crate, you unpack it, you put it on a table, something like this would be enough actually. And you get going, So then we can maybe help you with a remote connection and connect on the display and guide you through the first steps. But apart from then, it's we don't need to really worry about the laser. It's just a tiny little button where you push and that's it. So, but it's still a microscope, but relatively easy to use.
Do you need a piezo stage? So something that
we recommend it for time lapse. Yes. So if you do time lapse imaging, like 1 hour, 2 hours, it's if you kind of, I mean, they are these anti-vibration tables.
Exactly.
I think they're quite affordable nowadays. You can get it for like 6, 7, 8K euros. So. But we recommend it for like time-lapse imaging,
For sure. Very interesting. Professor Husken, he had this, I already mentioned this kind of flamingos, this microscope, they are light sheet, right?
Yeah, it's very interesting, I know it, fascinating.
And the idea there is that you not only have this fancy hardware that is on spot, but he also develops kind of a software trying to push like machine learning into, let's say his idea was like, put several samples and then the microscope they acquire 24/7 and they start talking to each other. Hey, I saw this, maybe you can look into that domain more, etc. Do you think about something in this domain in the future for your product, for example?
Yes, so the whole product has a Python API. So if you're really into, you want to avoid the user interface, which of course has some limitations, and you want to have your own workflow to that, then there's a Python API that is, of course, for someone who knows Python, straightforward to use. So all the functionalities can be called by a Python API. So that allows you to really make your own workflow and automate the microscope even further, especially because everything is motorized or automized. It's really all the modalities, the laser control, objective revolver, modality change, settings of the PMD. So basically, all the stuff can be controlled with an API interface. So that definitely helps to make your own workflow, to really customize the system to your own needs.
That adds another layer of flexibility, which is
yes,
incredible.
Right, exactly.
Incredible.
Right.
Wow. I want to go back to your time at ETH because I mean, more or less we talk about academia quite a lot, and I want to hear your opinion about your experience. As I mentioned, this is one of the most prestigious universities in the world. How hard was it to get in there? What was so special about it, for example? Can you share with us your experience?
So you're getting into ETH. There's a catalog of subjects actually you need to have in your high school. It's definitely wise to read it carefully, what you really need to take as courses. And then the grades, I think you don't need to be Einstein, definitely, to get into it. My grades have been average, so to speak, nothing special. But once you get into it, ETH has a really commitment to be a top-notch university. It really trickles down from the management, so to speak, to the staff and to every student, actually, postdocs, PIs, everybody who is involved. It's a clear vision that we want to be number one. Right? And it has the required funding. Obviously, without funding nowadays, it's hard. But it also has the ecosystem which is built in. I think you have a lot of startup companies at ETH. There are a lot of big corporate companies around. There's a Google Research. There's IBM Research in Rüschlikon, where I did my master thesis. So, of course, as a student, when you do your master thesis at IBM and there's a Nobel Prize laureate just next door, that naturally motivates you, right? And you also see that, okay, this guy, he definitely has a Nobel Prize, but he also puts on his pants like anybody else, Okay, so that really motivates you. And in Zurich, you have the financial institutes, which are very strong. So VC backing, which is very important for some of the companies. And in Basel, which is close by to Zurich, all the pharmaceutical companies, which are which have big campuses and research going on. So it's really the mix of top-notch academics with a clear vision of being number one, with the funding, together with corporate startups and the financial backing of the private sector and the banks, of course.
And was it like your initial kind of vision, I want to study physics, or how did you ended up studying physics actually?
Well, yeah, so when I was 18, of course, I wanted to either become a pilot or like a physicist, which was the decision at that time. So I've chosen physics, and I stumbled into that. So you study there, and then I had the opportunity to work at IBM Research for my master thesis, and from there changed back to ETH, and so one thing got the other. Sometimes definitely you have to be curious about a little bit of entrepreneurship and looking into that field. So as if you're a student, a PhD student, and you get interested into a little bit entrepreneurial thinking or in this world, then there are a lot of opportunities to work on actually, and institutes, or you see a lot of things that happen during your PhD where you think, oh, that should be improved, right? Or that sucks, stuff like this. And usually that's the beginning, when you're aware of this, usually that's the beginning of companies. No, I mean, companies are not formed by like the Heureka moment. No, either they are formed by, oh, that really sucks, or like, oh, that's interesting, that's a funny effect, what is this, So these are mainly the things when companies are formed, by these two incidents.
What do you think? People who are doing PhD, what kind of, what character, what qualities, what knowledge do you need to start a company on your own? What is the most important thing?
Most important is just do it. I think vision without execution is hallucination, right? I think, and I heard a lot of people saying, well, with that pricing, or with that's it. I can do that. Yeah, then
do it.
Do it. I think that's the first step. Just do it actually. And then I was lucky that with Gigaterra, the first startup company I was involved, I could really. It was a small team, small company, startup, so I could see the business aspect of companies, and not just the technical aspect, the business aspect. So learning from others, from the failures and also the success, of course, is something. Then you need, I think, the personal environment which supports you, which is there. You need definitely patience, but usually when you work in -2, when you're used to work in -2, you definitely have patience. I think that's one thing that PhD students they naturally come with. Really being patient. It takes weeks, months, of years of doing it, and improvement and all of that stuff. So being patient is something. I mean, you have to at the end, you have to accept that you need to sacrifice something in life. So either friends, or maybe you don't want to maybe found a family, or you definitely your Netflix time needs to reduce, or your TV or social media, or sometimes your health. I mean, definitely when you will gain weight. I mean, let's be honest. I mean, after having jet lags and traveling around the world, eventually you will gain weight. Maybe some mental health issues and stuff. So you have to know that eventually you need to sacrifice something in life for that. It doesn't come for free, of course. And the other thing, once the company is going and definitely bootstrap. So save the money. If you run out of cash, it's over, right? Save the money. So you don't need to hire an MBA, but just do some basic, keep the spending momentum low, the burn rate, watch the burn rate. And when the company is going, be flexible, because often you start with an idea. I mean, I would even say you don't need a business plan. Like maybe 1 page is enough. Just make some notes. But eventually when you start a company, like 2 years later, you find out that, actually that might not work, or there's another opportunity. So you really have to be flexible in deviate suddenly, make a right turn and do something else where you see opportunities coming up. I mean, there are a lot of opportunities coming up, just talking to others and visiting others and gaining know-how. So being flexible in maybe adjusting the direction you took from the very beginning, and then at the end there's a totally different outcome. Who knows?
So resilience is definitely one of the core
resilience
aspects.
But as I said, I think as a PhD student in our field, in -2, you definitely get resilience. I think that's not the problem then at the end.
Yeah. What keeps you sharp outside of your work day, or what helps you? Let's say we call in German they call that Stress abbauen, like to reduce stress, for example.
Yeah, definitely my family. I think we have 4 kids and married, and definitely spending time with my family is. I like the outdoors. So even in winter, of course, it's alpine skiing, backcountry skiing. That's what you do. In summer, it's definitely hiking, being on the water, like sailing, stuff like this. That really helps to to not to think of the company all the time. But obviously, once you are involved in a company, it's always present. I think that's also, you have to get used to it. It's every day, it's present. You check your emails, maybe you do this and that, and you forget something, it comes to your mind, you make a note so you can tell the team on Monday. So that's always present, But definitely, spending time with the family is probably the most valuable time to, get a little bit of distraction from the daily work.
Nature, family and nature.
Family and nature, yes.
And Austria, where in Austria are you located actually?
We are at the border to Switzerland and Germany, at the Lake of Constance.
Oh, that's
so close to the border, actually.
Very beautiful
so
place.
On one hand, it's mountains, on the other side is water. So it's definitely a nice place to stay there.
Yeah. Really, you can combine all of this that you mentioned: skiing, hiking, water sports. Exactly. That's amazing. I've never been down there, but I plan to visit. And also, Switzerland is one of my list on the list for future, development. It's interesting country. Austria also. I was recently in Vienna in a fest.
Yes. No, they have a vibrant community in Vienna as well. Yeah, it's interesting.
Very, very pretty city. For people who have never been there, please go and visit Austria. And I was lucky also. I love football, and there was the European Cup, and Austria was playing against the Netherlands. I was able to watch the game with Austrians, at the Danube River. It was very funny.
True.
Very nice and pleasant people, I must say. Yeah. At least from my interaction, you never know. Professor Krainer, we are slowly approaching our time limits. Thank you very much once again for coming extra for our podcast. I really enjoyed our discussion, and I learned some of the aspects about Two-Photon that I was not aware of, and I think I really will read up after our podcast. I don't know if you want to share anything with the people, or we just meet somewhere else on the globe at some conference in the future. And I wish you all the best with your company.
Yeah, thank you for coming here. It's a nice place in Göttingen. It's, I think, a very prestigious place now, also for neuroscience. And thanks for inviting me here.